Hi. Good afternoon, everybody. I am Dr. Nutan Desai, consultant gastroenterologist working at Fortis Hospital, Mulund, Mumbai. Today, we are going to discuss a few things about a very common problem, constipation. All of us experience constipation sometime or other in our life, but constipation is a persistent complaint in a sizable population in both adult as well as children. Let us discuss about adult constipation. About 10 to 15% of patients will experience persistent constipation, and as you age, the problem becomes more common. Constipation is often a frequent complaint in women more than men and has various causes to it. The role of a doctor actually here is more to rule out secondary constipation and then to advise, if once that is ruled out, then to advise the patient on lifestyle modification, medication, and other things that can help him relieve his complaint of constipation. So, what exactly is constipation? Is it always infrequent bowel movements as we understand it? Not necessarily so. Quite often, what patients mean by constipation is a sense of incomplete evacuation with or without abdominal discomfort, bloating, or sometimes even painful defecation. So, it can have different meaning for different people. In some people, it is genuinely a very infrequent bowel movement. Some people say they don't get a urge, so they, as a routine, go and sit on the commode to have motions, but don't get satisfactory motion. They all have to strain a lot, or their motions are very dry, or they are very painful, or when they pass a motion, their perianal area gets sour. So these are the things which patients will come and categorize as constipation. So when you evaluate a patient of constipation, the most important thing is to take a proper history. Once you understand what exactly the patient is meaning by the word constipation, you should then look for other clues. Basically, you look for secondary causes of constipation, which include metabolic causes like, say, diabetes or thyroid problems or hypercalcemia secondary to various causes, or neurological disorders like Parkinson's disease or a stroke patient. Um, or some infections or some autoimmune conditions like scleroderma. You also have to take the patient's history of medications because quite often, quite a few medicines that patients take for various disorders can lead to the complaint of constipation. So once you've done that, and then you have to look for signs which may give you a clue that this constipation could be a manifestation of a more serious disorder, say like a colonic stricture or a colonic mass, basically a malignancy or an intestinal obstruction somewhere. So there are various ways in which constipation, which um, various reasons why a patient would complain of constipation. It's basically the skill to dig out what could be the possible cause. Once you've ruled out any sinister cause of constipation by the way of history and relevant investigations, then you can start advising the patient on the lifestyle modifications, the do's and don'ts, and take it from there. So once we have ruled out the secondary causes, let us look at primary constipation. Primary constipation is constipation which is experienced by patients genuinely because their bowel movements are really not regular. And this may be slow transit or normal transit constipation. So primary constipation will be divided into three types. A normal transit constipation, which is seen in about half the population, or a slow transit constipation, which will be seen in about a third of the population, or a defecatory disorder where the movement of the colon is okay, but the act of defecation is not right. The coordination of the various muscles involved in the act of defecation is not right. So how do you then treat these patients? So it depends on what is it. If it is a normal transit constipation, you can try by regularizing the patient's timings of eating. Especially you have to counsel them to take breakfast because post breakfast the bowel movement is the highest, and therefore Many patients, if you just regularize their food timings and consult them about adequate fluid intake, will have a substantial relief of the symptom. In case of slow transit constipation, you can try various prokinetic drugs, but in very refractory cases, you may have to advise surgery, though this is extremely rare. If it is a defecatory disorder, you have to evaluate what kind of a disorder it is and then treat it accordingly, usually by means of biofeedbacks or enemas. Sometimes constipation is secondary to an acute event, like say dehydration, in which case correction of the acute event will resolve the problem. In children, often there is a problem of constipation where you have to consider another set of disorders. Most important amongst this is a disorder called as Hirschsprung's disease or congenital aganglionosis of a segment of the colon. Uh, so, when children come with constipation, it could be because of faulty diet, faulty toilet training, or a perianal issue which is causing painful bowel movements, because of which the child is voluntarily holding back the feces. And you will have to look at all these factors. Sometimes you have to uh, also inquire into family history of constipation and then do an examination to rule out any local problems like imperforate anus or anal atresia, and take the history of onset properly. So, when you go to the doctor with a complaint of constipation, the basic investigations he will ask you will involve ruling out metabolic disorders. He will ask you for your medical history, your medications if you are taking any, and will may ask for some imaging investigations like an ultrasonography or sometimes a barium study or a colonoscopy, and plus minus a CT scan, depending on his or her judgment as to what could be the cause of your constipation. Um, Once a defecatory disorder is suspected, then there will be a test called as anorectal manometry, which is advised to characterize the form of the bowel movement properly and to see whether the coordination between the various muscles is right or not. So, are there any questions? So, a few tips I would give for many people who experience transient constipation. So, unless you have symptoms like weight loss or bleeding PR or a constipation which is too severe or abdominal pain associated or associated anorexia, vomiting, abdominal distension, you could try a few things. A, take your breakfast and take a good breakfast regularly. Drink enough water. By enough water, I mean 1 to 1.5 liters in a day and not 3 4 liters in a day. Have adequate activity levels. Fiber, the role of fiber is really little controversial, but as long as you have a say a couple of vegetables in your diet in reasonable proportions, fiber should be all right. If you feel your fiber intake is too low, you can add a little bit of bran to your diet. And having regular toilet timings also would probably help you to get relief from your constipation. Crimefin is given basically for acute treatment of constipation, and we usually give it either HS, that's a single dose in the night, or at the maximum two doses. And we don't give crimefin beyond a week or two. By then, your cause of constipation is evaluated, and then you shift either to your bulk forming laxative or osmotic laxative as per the patient profile, or you treat whatever is the condition which is responsible for the constipation. Rectal suppositories and enemas are usually used only for relief from fecal impaction quite a few times. And for patients who have a neurologic cause of constipation, where they are absolutely unable to generate any rectal pressure, or and therefore you are forced to use these forms of therapy. Sitz bath is used in painful perianal conditions like fissures or hemorrhoids which are inflamed. Otherwise, there is no role in treatment of constipation per se. थैंक यू. हो गया था, दो ही क्वेश्चन था.